Hi, I'm Dr. Jon LaPook, Chief Medical Correspondent for CBS News, and this is CBS News contributor Dr. Tara Narula. Dr. Narula is a practicing cardiologist, and I'm a practicing internist and gastroenterologist, and welcome back to Doc Talk, where we talk about the things in the health news that are interesting us the most. And I have to say, measles, it's still in the news.
Yes.
What are you hearing?
So we're hearing more and more cases, over 70 cases confirmed. It's spread as far north as the Bay Area. So this is still a big problem in California, especially. I think one of the big things to emphasize is really the complications relates to measles. You know, I think people think of it as just kind of cold symptoms and a rash that goes away and gets better, but it can be pretty serious in terms of causing death, encephalitis, keratitis or an eye infection, ear problems down the road, or even heart problems.
Yeah. And I actually was looking up the statistics of this, and people forget that before there was this vaccine, it really was introduced in 1963.
Yeah.
Before that, there were 3 to 4 million cases a year. 500,000 cases a year were reported, and about 500 deaths. So that's about 1 in 1,000. The people are just blasé about it because they haven't really seen it. And this is so highly infectious. And one person will infect 12 to 18 people on average. Those people who are not adequately immunized, right? Flu, the R0 is 1 to 4, and Ebola, everybody was so afraid about Ebola, of course, rightfully so, frightening, but the R0 for Ebola was 2 to 3. So really, this is way more infectious for a couple of reasons.
That's right. Well, it hangs out in the air for a couple hours. So if you cough or sneeze, those droplets are still airborne, and so you can infect people, even if they're not in the room, if they've left the room after they've coughed.
That's right. And you can be infectious for days, several days before you actually get a rash, and
several days after.
And of course, several days after. And that was one of the things we kept saying about Ebola, is that it wasn't, that infectious in terms of it spreading widely, because you had to have symptoms in order to spread it. You had to have direct contact with somebody's body fluids.
That's right.
This is not like that at all.
The same.
Here, it's very infectious. So the bottom line here is that year after year, these outbreaks, which happen every year, they're spread because of pockets of unimmunized people. They're driven by people who are not vaccinated. So the bottom line here is that the CDC is recommending, unless there's really a very strong reason not to get it, a medical reason not to get vaccinated, they're recommending vaccination.
That's right. That's right. So one other thing that I thought was really exciting this week was a discussion of coffee and how your morning coffee, or 2 or 3, might actually prevent skin cancer, a particular type of skin cancer, melanoma, which we know is basically the most lethal of all skin cancers. So, this particular study looked at, I think, over 400,000 patients and really found that those who drank over 4 cups of coffee a day had almost a 20% reduced risk of getting melanoma. What do you think about that?
Well,
Are you a coffee drinker?
I was a coffee drinker, then I was not a coffee drinker. Now I'm sort of on and off. But I actually spoke to Erica Loftfield. I want to get the name right. Erica Loftfield, who is one of the lead authors here, a few minutes ago. We give you the latest. And I said, what about all this? And she pointed out a couple of things. And she said that, first of all, there was a dose relationship. So it really did look like there was a relationship between the more you got, the more protection. It was only with caffeinated coffee, not decaf. And there might be a lot of reasons for that are sort of probably too complicated to go into. But, I said, what's the mechanism there? Is it the caffeine? Is it something? Because caffeine possibly could be protecting you. Polyphenols, antioxidants, flavonoids. There's lots of stuff in coffee, right? But it's not, the decaf doesn't protect you. The takeaway message from this was, don't go in the tanning salon. I just love that. Basically, she's saying it's reassuring for people who are already drinking coffee that it's not going to hurt you.
Right.
And in fact, there are some other studies suggesting coffee can be beneficial in preventing liver disease and some other problems, maybe for Parkinson's. But she's not recommending that somebody go out and drink a lot of coffee because you want to try to prevent melanoma. It's just sort of more reassuring. And she said, really, the #1 lesson for people is use suntan lotion, avoid a blistering sunburn. One blistering sunburn when you're a child can double the risk of melanoma, and definitely don't go in those tanning salons, which have been associated with melanoma.
That's right.
So I love that. That was very wise. She had this whole study. She did all this work, and then the takeaway lesson had nothing to do with her study. So that's really somebody who I thought was really wise.
That's right.
The next thing that I found very interesting was there were a couple of studies right up your alley and right up my alley. The one up Tara's alley is about sedentary lifestyle, because it turns out that the more you sit, the higher you are at risk for a lot of problems that you tell us about.
Yes.
And the thing that was up my alley was pizza and the effect of pizza. But why don't you tell us about the pizza?
Yeah, so the pizza subject came up because what we're finding is that kids consume a tremendous amount of pizza, not just kids, but adolescents. And that pizza is full of sodium, it's full of saturated fat, it's full of calories. And so when kids eat pizza on a daily basis, in this recent study that came out, they increased their calories anywhere from 400 to 600 calories on the day they ate pizza. They increased their sodium by almost up to 400 milligrams, and they increased their saturated fat anywhere from 3 to 5 milligrams. That's really a lot. And so the message isn't to villainize pizza, but really to make people more aware of how prevalent the consumption is and to really try to get them to eat healthier types of pizzas.
So, you know, there is a movement here, and there are laws now that say if you have a restaurant that's 20 or more different sites throughout the country, that you have to post calories, and there's also a requirement to have nutritional information available if the person asks for it. So this is moving towards this whole idea of transparency, that really there are all different types of foods. One pizza here is different than a pizza there. So I went online, and I actually went to the Domino's Pizza site, and I found, to my surprise, there was a wonderful application. So if you see it on your screen, you'll have the URL for where to go to, and then we're going to build a little pizza here for you just for fun. So we're going to choose a thin crust. It's going to be 12 inches, and what do you think, extra cheese?
Extra cheese.
Extra cheese. I'm going to ask for some mushrooms. And as you choose each of the things, the number of calories that it's adding is popping up next to it. So the total caloric expenditure here is 335 calories. That's a lot. And then if you click on the right where it says details, you'll see saturated fat, 7 grams, that's a lot.
Yep.
Salt, 665 milligrams. If you have high blood pressure, that's salt responsive, you may watch that.
That's right.
And then carbohydrates, 31 grams. That's not too bad, about 120 calories from carbohydrates.
I mean, the salt and the saturated fat are really the big problems. I mean, the American Heart Association recommends that your saturated fat intake be really less than 5 a day. And here you're getting 7 with one pizza.
Yeah.
And sodium, too, should be less than 1,500 milligrams. And you've got 600 by your count right there, which is essentially almost half of your daily recommended allowance.
I think this is a good example of transparency.
That's right.
And this shouldn't be an ad for Domino's, but it's an ad for the idea that I think all of these companies really have things online now, and I think this kind of interactive application is very interesting. And I'll just briefly mention the sedentary study, which is now, the worst thing is now to eat your pizza sitting down for more than 4 hours a day. So basically what the study showed is that, Dr. Alter was the person who did it, and I spoke to him. It looks like anything more than 4 hours of sitting in a 12-hour period increases your risk for a lot of things. Cardiovascular disease, heart cancer, early mortality, and diabetes, like a 90% increased risk of diabetes. And it's, again, dose responsive. So as you get to be 8 to 9 hours of sitting in a 12-hour period, not so good. And here's sort of the good and the bad news. The worst is if you're sedentary and you're doing no exercise. Then there's an average of about 15 to 20% increased risk of all of these problems that we talked about if you just on average. But if you do no exercise and you sit 8 or 9 hours, then you're talking about a 40% increased risk.
That's right.
If you do exercise, you drop it to 10% increased risk, but it doesn't go to zero.
Still a lot.
It doesn't go to zero.
It's really disturbing.
So let's just stand up and do that or something, move around. What do you tell your patients in real life? You know, they're at work.
Yeah.
What kind of advice do you give?
You tell them to try to build in standing into their day in any way that they can.
And
so
how do they practically do that?
if they're sitting at their desk and they're on a conference call, they should stand up when they're talking. If they're at home watching television and it's a commercial, stand up, walk around. So little intervals interspersed throughout the day can make a big difference.
The last thing we want to talk about is your favorite.
And my last thing is, what is the value of an annual office exam?
Why is there a controversy?
It's such a controversial topic. I mean, when I read this, I had a very emotional reaction to it as a doctor and as somebody who's been a patient. There was an editorial in the New York Times by Dr. Zeke Emanuel, which called into question the value of an annual physical exam. And this isn't something that's new. We know that the current major medical organizations like American Medical Association and American College of Physicians actually don't recommend for or against an annual exam. So it wasn't like he was actually saying something that's not already out there. But I think it does generate a very emotional reaction from people. You're used to this idea of going in to see your doctor every year. You think that there's benefit from it. You think there's benefit from getting more and more tests, that you're helping yourself. And so to have somebody say, well, actually that might be harming you or there's no value to it, I think makes everybody a little bit uneasy. The big point is really overdiagnosis and overtreatment. I think, most people don't understand that when you get tests performed, whether it's a lab test or an X-ray or an EKG, many times we find something. And when you find something, then you're going down the rabbit hole of trying to figure out what it is you found. Is it clinically important, or is it what we call a false positive, which means it wasn't really real in the first place?
So that's the logical, we talk about
Right.
evidence-based medicine now because we have to prove that everything is really helping, or at least that's the trend. The punchline there is, I guess we're being a little bit old-fashioned
A
here,
little
and it's
bit.
a little against it, the trend of having to be able to measure everything. But we still think that there's value in doing a clinical exam, even if you feel well, just routinely coming in. But we're willing to admit that there's room for discussion about that. And finally, we finish with
Our clinical pearl of the week.
clinical pearl of the week.
So a little teaching point. Patients always come in and we ask them what their medications are, and most of them have no idea, or they don't know the dosage or the name, and this is so important. So our clinical pearl is, if you're going to the doctor, bring your medicine bottles. Bring a typed list of every medicine you're on, every dose, and how often you take it. It's so critical to the physician being able to really treat you and treat you the right way.
Yeah, the hardest thing is when you say, so what medicine are you on? Oh, that little pink one.
Yeah, I have no idea what that is.
Doesn't help me. And I would say the corollary to this is if that you're going, have an electronic healthcare buddy, which means some friend out there who has your
that.
record, right?
Yeah.
They have a list of your medicines, your medical problems, the doctor's phone number, so that if you end up, you're on the beach in Hawaii, you go to the emergency room, you're in your bathing suit,
That's right.
you don't have anything, you can call somebody and say, look, email them this information.
Yeah,
That is
absolutely.
our clinical pearl, or clinical pearls of the week. And thank you so much for joining us on another edition of Doc Talk.